Okay, my name's Scott Bertrand. I'm the inventor of the AllCore 360. And I'm fortunate enough here today to be at KalQlate Science here in Nashville, which we find one of the thought leaders in the area. They've purchased the AllCore 360. It's now currently in their biohacking space. My advice would be at least give yourself an opportunity to see how different this is and how innovative it is to work on the core. I'm going to walk you through a short session here of how the actual works. We got a patient in here. Luke's in the machine. What he's done is we've taken the lower section of his body and completely stabilized it. There's no need for any legs or anything below here, so these are out of the work. From here up, we're going to train the core. The core is a tube of muscle that starts at the pelvic floor and comes up at the chin. So we've got all these hundreds of muscles we're going to chain isometrically by using his body weight against gravity. So we're getting ready to start, and we're off. What we're going to see right away is as he tilts back, what's happening is the whole anterior compartment, the dozens of muscles that have to contract to keep them off the back pad, are engaged. That's 100% anterior. As we turn slowly, it goes from 100% to 90%, 10, 80, 20, 70, 30. By combining the contraction of two adjacent lateral groups like that, we work with a situation called the Hebb's Law. The Hebb's Law basically says if you fire together, you wire together. So it's very unique for a core machine to actually develop core coordination. You develop coordination on this device. It's designed to develop balance and a perfect posture. When you're on the device, depending on the angle you're at, that will determine, you'll be able to feel the difference in difficulty. If the difficulty was the same all the way around, you'd be balanced. What you're going to find, and most of us aren't balanced, we have three major imbalances when we come into a clinic like KalQlate. There's a big front to back imbalance, which means our low backs are stronger than our abdominal muscles. A little bit to your right. We've got a right to left imbalance, usually because we brought into the world right or left-handed. It's not the fact that we're right or left-handed, it's how we use that dominant side throughout our life. And then we have a preference for turning right or left or clockwise or counterclockwise. We all have an imbalance in that when we start on the program. And in 4 weeks, we can balance this out on this device. The nice thing about this is none of the muscles in the body have done this before. So I don't care if you've done 1,000,000 sit-ups or 1,000,000 deadlifts. All your muscles start out at the same. So in 4 weeks, they all jump on together, and that's how the body works. It works homeostatically. It doesn't work with individual components. You move through space against gravity all day. The proper way to train your body is to move it through space against gravity. I was a chiropractor for 35 years. I injured my back in a skydiving injury. I injured my neck in a swimming pool accident. I understand how the core works. I understand how the core functions. I understand core pain. What I can tell you is this made a huge difference in my life, a huge difference in my practice. And currently it's in many spinal cord injury centers throughout the United States and in the advanced cutting-edge performance enhancement centers. Now it's going to go in the other direction again, trying to maintain that balance. The angle of resistance, this angle that the seat is at, determines the difficulty level. Obviously we can take somebody that has very weak core and start them at an angle that's challenging for them. The very next person can be an Olympic athlete. I can put that person on there and give them an incredible 10-minute challenge. And the next person could be a Paralympic athlete with no function of the legs. So there's very few people that we can't address with this. As a chiropractor, what I found in practice, all chiropractors have exceptional techniques on how to put bones in their proper position. They train for years. It's a skill, it's a talent, and they get very good at that. But the problem with chiropractic I found was we can get the bones in place, but it's the muscles of the body that maintain that alignment. If your muscles are not balanced, it doesn't matter how many times I put them in place, your muscles are going to pull them back out. What we find in the country is low back pain is 95% of the people in the country have low back pain. That high percentage of that is due to imbalance. It's because we purposely create imbalanced cores by training an isometric muscle isotonically. So this is the way the body was designed to perform in the core. It's an isometric muscle, and we're challenged it isometrically. And we do it in 10 minutes. Not only are we getting the whole core, because of the challenge and the difficulty level, this is a cardiovascular exercise. So picture what that says. All the people in your practice, all the people in your life that don't have good knees, that don't have good ankles, that don't have good hips, it's very difficult for them to challenge their body in a way to get a cardiovascular challenge in exercise. This will do that. Senior citizens, their problem is balance and heart problems. What does this correct? Balance and heart problems. As we get older, we need to cut that off at the pass. It's coming. We're getting older or we die. So that's coming. Get ready. But I will say this. I've been all over the country doing these. setting these up. And I'm just going to point out a little bit about KalQlate Science here in Nashville. Most of their clients had pretty strong cores and pretty balanced cores. These people are going to be at the very top. I can just commend you on what you've done prior to us. And if I was somebody in Nashville and I was looking for a place to land, I'd start here. I probably wouldn't leave.